Hi, welcome to Socialpost Health Channel viewers. I, Dr. Chava Anjaneyulu, Chairman for Asian ENT Care Center and Senior Consultant ENT Surgeon for Asian ENT Care Center and Apollo Hospital, Jubilee Hills. Sinusitis, everybody, they will have one attack of sinusitis in their lifetime. This is very common term. Any nasal problem, patient will call it generally as a sinusitis. That is inflammation of the paranasal sinus. That may be maxillary sinus, ethmoid sinus, frontal sinus, sphenoid sinus. These are the sinuses around the nose, around the eye, below the brain. Why sinusitis is so important? Why we have to prevent this? Why we have to treat this? Because sinusitis, one way it causes continuous disturbance in your lifetime. If you are sneezing in your office, you will not feel good. If you have nasal discharge, coming water secretion into the nose, in any social gatherings it is not good. You will feel not good. Same as sneezing and nasal discharge, nasal obstruction. Sometimes they will have asthmatic attacks with the sinus. Because of continuous irritation of the pharyngeal airway, laryngeal airway, they will have cough continuously and throat irritation. They always say that also not good. All this disturbance the patient routine life and their sleep also. Second is, sinusitis may cause the life-threatening problems, complications. It may extend into the eye, cause loss of vision. It may go to skull base. It is very difficult. Skull base osteomyelitis is a very dangerous condition, very difficult to treat, and we have to give long-term treatment with major surgeries sometimes. And through that thin bone which separates sinus and brain, this disease may enter into the brain, especially bacterial infection. Severe bacterial infection may cause the brain abscess. Severe fungal infections, it may involve in the brain. Sometimes this sinusitis may lead to meningitis and encephalitis in children. So sinusitis, common disease, if you neglect it may cause very life-threatening problems. Don't neglect. It is very simple issue. If you get treatment early, if you get prevention from the predisposing factors, this is very easy to get the treatment. First, sinusitis, how to treat? Only home remedy measures will help, or can we go for medical treatment, or patient need the surgery? Yeah, sometimes, most of the times, if once in a while if we get the sinusitis, we can do home remedy measures, it will subside. Mainly if you have the sinusitis, cold problem, take the rest. With the rest, body immunity will improve and it will prevent further increase of this sinus problem or acute viral infection problem. Steam inhalation, daily 2-3 times steam inhalation. Take warm diet, avoid cold and spicy food, and take little bit soup with good balanced diet. That will improve your body resistance, defense mechanism. You will recover very fast. And intake of proper food along with the rest will get relief from this acute viral infections. And always if you have the chronic problem or recurrent acute attacks, get evaluation by the nasal endoscopy and plain CT scan of the PNS. If you have the allergy problem, mainly sneezing, you get an allergy test, either from blood or skin prick test. In nasal endoscopy, if you have deviated nasal septum or turbinate hypertrophy, you simply do the septoplasty and turbinate reduction, your symptoms will subside. If any problem in the sinus, significant problem in CT scan, at the same time you do the endoscopic endonasal surgery, you clear that sinus and the patient will get relief. That means sinusitis with deviated nasal septum, turbinate hypertrophy, you simply clear all these problems with the surgery. And if you have the allergy problem, you do the mucosal desensitization. If the allergy is severe, you do the immunotherapy. Immunotherapy will help to cure your allergy by desensitizing the body. Simultaneously, you do the coabulator or any ablation of the postnasal nerve mucosa and turbinate mucosa. Like this, both surgery, medicines, preventive measures all will help to cure the sinusitis problem, to prevent the recurrent attacks for long healthy life. If you have severe problem, you take medicines for 5 days to 1 week, don't go for more than that. If going for more than that, just contact the ENT doctor, so he will guide you better, either in preventive measures or any surgical requirement or medical requirement. If you have any sinusitis problem, chronic nasal allergy problem, nasal obstruction problem, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Social Post Health channel YouTube.